COVID-19 cases have dropped sharply over time, but occupational health experts have cautioned South Africa to continue strengthening its health and safety measures in the workplace. They've highlighted gaps in data collection, lamenting the lack of numbers that will give a clear picture of labor cases and lives lost in the country at the height of COVID-19.
Worrying is the fact that, as we can see glaring, there is generally not adequate information about the workplace regards to infected workers as well as workers who demised because of COVID-19. And as such, we need to work on our surveillance system, establishing them, maintaining them, making sure that they produce relevant data that can be used to make decisions about health and safety in the workplace.
Some workers formed part of the frontliners during the peak of COVID-19, with the Institute revealing that this group was the most exposed to the virus. Experts believe more needs to be done to protect and rehabilitate workers in the country, putting emphasis on employee health and wellness, also in the protection of service provision, especially in the healthcare sector.
We should continue to strengthen occupational safety and health measures in our workplaces, adapt work arrangements, prevent discrimination and exclusion, provide health access for all, and expand access to paid leave for workers. However, we cannot talk about policies and not mention the Department of Employment and Labour in South Africa.
Calls have also been made on the availability and sustainable management of water and sanitation to prevent waterborne infections and pathogens.
Workplace exposure is often an under-recognized problem. However, exposures to waterborne pathogens in these settings do occur. For example, healthcare workers working with water-related devices that generate aerosols. Critical reservoirs in these settings include emergency showers, eye wash stations, and dental unit water stations and other aerosol-generating devices. Sanitation workers, including wastewater treatment plant workers, septic tank and pit toilet emptiers, are also at increased risk of exposure to waterborne pathogens.
The Department of Employment and Labour, alongside unions, have been called upon to ensure that companies adhere to the Occupational Health and Safety Act of 1993. Katlego Legodi, SABC News, Johannesburg.